The beta-lactam antibiotics are divided into 4 groups, and these include penicillins, cephalosporins, carbapenems, and monobactams. In my previous lectures, I have explained in details about penicillins and cephalosporins. Today here in this session, I am going to talk about monobactams and carbapenems. Let's start off with monobactams. Under monobactams, we have astrolam. So astrolam is classified under monobactams. If you look at the structure of monobactam, the monobactams have a single beta-lactam ring, unlike other beta-lactam antibiotics where the beta-lactam ring is fused with a sulfur-containing 5-membered ring. So the second ring is absent in monobactam. It is a missing structure. It has a single beta-lactam ring which is not fused with any other ring, and therefore it is known as monocyclic beta-lactam antibiotic. So it is known as a monocyclic beta-lactam antibiotic because it has a single beta-lactam ring, unlike other beta-lactam antibiotics where the beta-lactam ring is fused with a second ring which is also known as thiazolidine ring. So now that we know the structure, coming to the antimicrobial spectrum of monobactams. So monobactams have a narrow spectrum of action. It is highly active against gram-negative enteric bacteria. So it is highly active against gram-negative enteric bacteria. They are primarily active against bacteria such as E. coli, Salmonella, Shigella, H. influenzae, Proteus, Klebsiella, including Pseudomonas at moderate concentration. Therefore, they can be used for treating serious and complicated gram-negative infections such as septicemia or infections related to urinary tract, biliary tract, gastrointestinal tract, and female genital tract. In this way, it closely resembles the antimicrobial spectrum of aminoglycosides because aminoglycosides is highly active against gram-negative infections. So an advantage of astrolam of monobactams is that it is well tolerated in patients with renal impairment, can be safely used in patients with renal impairment for treating gram-negative infections such as septicemia or infections related to urinary tract, biliary tract, gastrointestinal tract, genitourinary tract. So these are some of the infections that can be treated with monobactam since they are highly active against gram-negative infections, and also in patients with coexisting renal disease because in these patients aminoglycosides are avoided. Also, another advantage of monobactams is that it is safe in beta-lactam allergy because beta-lactam antibiotics such as penicillins and cephalosporins are known to cause hypersensitivity reactions, and monobactams, because they lack cross-sensitivity with other beta-lactam antibiotics, do not cause hypersensitivity reaction. They can be used in patients who have shown hypersensitivity reaction with penicillins or cephalosporins. So they are considered to be safe in beta-lactam allergy. Now let's move on to carbapenems. Under carbapenems we have imipenem, which is combined with cilastin, meropenem, doripenem, faropenem, and ertapenem. So these are some of the carbapenems, and we will be comparing the characteristic features of various types of carbapenems. Now, limitation of imipenem is that it undergoes rapid hydrolysis by a renal enzyme, that is dehydropeptidase 1 enzyme, which is expressed in the brush border of the renal tubular epithelial cells. So it is combined with cilastin, which inhibits the enzyme, that is the renal peptidase enzyme, thus protecting imipenem from degradation, and this ensures the therapeutic efficacy of imipenem. So imipenem action is protected by cilastin, and therefore imipenem is combined with cilastin. It has a protective nature. It inhibits the degradation of imipenem, thus prolonging its duration of action, and is useful for treating serious complicated gram-negative infections. Now, some of the side effects that are related to imipenem use are diarrhea, nausea, rash, hypersensitivity reactions. But a specific side effect that needs to be kept in mind is that imipenem at high doses can induce seizures. So, it can induce seizures at high doses. Therefore, caution is necessary with the use of imipenem. Now this slide compares imipenem with meropenem. Now meropenem is also administered intravenously similar to imipenem. It also has a broad spectrum action and therefore they are useful for treating serious complicated infections, infections that are resistant to cephalosporins and diabetic foot infections because they are highly effective against anaerobes. But for pseudomonas infection, meropenem should be combined with gentamicin, which is an aminoglycoside and it has pseudomonas activity. Also, meropenem has good penetration into the central nervous system. Therefore, they can be used for treating meningitis. Now, some of the advantages of meropenem over imipenem is that meropenem is not rapidly hydrolyzed by renal peptidase enzyme and therefore does not need to be combined with celastin. So combination with celastin is not needed in case of meropenem and also other carbapenems. However, imipenem has to be combined with celastin to ensure therapeutic efficacy. Also in terms of adverse effects, meropenem is less likely to cause seizures while seizures can occur at high doses with imipenem use. So this is a slide which compares imipenem and meropenem with other carbapenems such as doripenem, faropenem and ertapenem. Now do note that all carbapenems are administered intravenously with the exception of faropenem which is administered orally. So the carbapenem which is administered orally is faropenem. Now with respect to its antimicrobial spectrum, all of these carbapenems have a broad spectrum antimicrobial action. Imipenem and meropenem is used for treating complicated serious infections related to GI tract, urinary tract, biliary tract. However, meropenem has to be combined with gentamicin for infections against pseudomonas. Also, it is important to note that doripenem has enhanced pseudomonas action. Now, since doripenem has enhanced action against pseudomonas, it is preferred for treating hospital-acquired infections, nosocomial infections, febrile neutropenia, septicemia. On the other hand, faropenem, which is administered orally, has limited pseudomonas activity. It is used for treating infections such as respiratory tract infection, ENT infection, and genitourinary and GI tract infections. Now coming to ertapenem. Now ertapenem is a newer carbapenem but it is less broad spectrum. It lacks pseudomonas coverage and therefore it is preferred for treating community acquired infections rather than hospital acquired infections which are resistant infections. Now characteristic feature about ertapenem is that the half-life of ertapenem is 4 hours compared to the half-life of other carbapenems which is 1 hour. So ertapenem has a long half-life, so single daily dosing is adequate for therapeutic efficacy. So this is a summary slide comparing various carbapenems. So all carbapenems are administered intravenously with the exception of faropenem which is administered orally. With respect to the antimicrobial spectrum and indications, all of these carbapenems have a broad spectrum of action and the clinical indications are serious complicated skin and soft tissue infections, septicemia, intra-abdominal infections, pelvic infections, infections related to the female genital tract. To be kept in mind that doripenem has enhanced pseudomonas activity, faropenem has limited pseudomonas activity, and ertapenem, which is a newer carbapenem, which is less broad spectrum, it lacks pseudomonas coverage. Therefore, it is preferred for treating community acquired infections. Doripenem, since it is active against pseudomonas, it is preferred for treating hospital acquired infections, nosocomial infections that are caused by resistant organisms, and therefore doripenem is the drug of choice for hospital acquired infections and nosocomial infections. Meropenem needs to be combined with gentamicin for action against pseudomonas infections. With respect to the adverse effects, imipenem, as we have discussed, can cause seizures at high doses, whereas seizures are less likely with other carbapenems. A characteristic feature of ertapenem is that it has a long half-life of 4 hours. Therefore, a single daily dosing is adequate to maintain therapeutic efficacy.